Finnish sauna bathing is a form of passive heat therapy that is characterized by exposure to a high environmental temperature for a brief period. It is a tradition embedded in the Finnish culture and has commonly been used for hundreds of years for leisure and relaxation. Though there are other passive heat therapies such as steam baths, infrared saunas, and hot tubs, the Finnish sauna is the most widely studied. There is a growing body of solid research evidence showing that Finnish sauna bathing is linked with substantial health benefits beyond its use for leisure and relaxation. My name is Dr. Seto Kunicho, and I am an associate professor based in the Diabetes Research Center, University of Leicester, United Kingdom. I'm here to discuss our paper titled, "Does a combination of Finnish sauna bathing and other lifestyle factors confer additional health benefits? A review of the evidence." It has recently been accepted in the Mayo clinical proceedings and will appear in an upcoming issue. I'll first like to acknowledge and congratulate my co-author, colleague, and friend, Professor Jari Laukkanen, for his excellent efforts on this manuscript. In our previous comprehensive review that was published in the Mayo Clinic Proceeding in 2018, we showed that frequent sauna bathing reduces the incidence of vascular and non-vascular diseases, such as hypertension, cardiovascular disease, dementia, and respiratory conditions. It also improves the severity of conditions such as musculoskeletal disorders, COVID-19, headache, and flu, and increases the lifespan. Recently, there is emerging evidence showing that frequent sauna bathing is such a strong protective habit or lifestyle factor, which could potentiate the beneficial effects of other lifestyle activities, such as physical activity, and also attenuate or eliminate the adverse effects of other risk factors. In the current paper accepted in the Mayo Clinic Proceedings, my co-author and I comprehensively reviewed the available epidemiological and interventional evidence linking the combined effects of Finnish sauna bathing and other risk factors on vascular outcomes, including blood pressure and cardiovascular disease, non-vascular outcomes, and mortality. We also discussed the public health and clinical implications of the findings, gaps in the existing evidence base, and future directions. Our findings showed that some of the effects of frequent sauna bathing are comparable to that produced by regular physical activity. Combining frequent sauna bathing with physical activity produces more cardiovascular benefits than the use of each alone. For example, 8 weeks of regular sauna bathing sessions combined with 8 weeks of exercise produce a mean reduction in systolic blood pressure of about 8 millimeters of mercury, which is a very huge decrease in blood pressure. It has been shown that systolic blood pressure reductions of 5 to 7 millimeters of mercury among individuals with hypertension translate to a 20 to 30% reduced risk of cardiovascular disease. Combining frequent sauna bathing with high fitness levels was associated with substantially lowered risk of cardiovascular disease and death compared to frequent sauna bathing on high fitness alone. Frequent sauna bathing also appears to offset or eliminate the adverse impact of systemic inflammation, low socioeconomic status, and high blood pressure on outcomes such as cardiovascular disease, pneumonia, chronic obstructive pulmonary disease, and mortality. Sauna use produces some physiological responses and adaptations that are similar to that of physical activity. These include reduction in blood pressure, systemic inflammation, oxidative stress, cortisol levels, improvement in arterial stiffness and compliance, the respiratory system, boosting of the immune system, and so much more. Evidence from some of our published work shows that sauna works in synergy with physical activity to produce a greater effect compared to each modality alone. The evidence also suggests that the protective effect of sauna use is strong enough to attenuate or eliminate the adverse effects of other risk factors. Our findings have implications for public health practice. We all know the health benefits of regular physical activity. Several health benefits of frequent sauna bathing are comparable to that produced by physical activity. Adding frequent sauna sessions to regular physical activity will substantially augment the benefits of physical activity. Taking the overall evidence together, 3 to 7 sauna sessions per week, with each session lasting about 15 to 20 minutes, is associated with the most health benefits. Combining this with physical activity guideline recommendations of at least 150 to 300 minutes of moderate intensity physical activity, or 75 to 150 minutes of vigorous intensity physical activity per week, will promote substantial cardiovascular health and longevity. For people who are unable to meet physical activity recommendations or are unable to exercise at all for genuine reasons, regular use of sauna may be an alternative lifestyle strategy to ward off many disease conditions. However, we are not advocating that sauna should replace physical activity. Despite the growing evidence on the health benefits of sauna, there are still lots of unanswered questions. Most of the evidence comes from observational studies which cannot prove cause and effects. Only few randomized controlled trials are available on the health benefits of Finnish saunas. Well-designed randomized controlled trials are needed to provide more robust evidence on the health benefits of regular sauna use in combination with protective lifestyle such as physical activity. Furthermore, whether there are sex and age differences in the health benefits of sauna is uncertain. Most of the studies have been conducted in middle-aged and older men. Hence, studies are needed to clarify these uncertainties. Lastly, randomized controlled trials comparing the health benefits of Finnish saunas with other passive therapies like hot tubs and infrared saunas are warranted. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.